This is Elizabeth Randall. This is the sheep heart dissection video for Azusa Pacific Bio 235. We're going to be looking first at the external anatomy of the heart, and the first term to define is the visceral pericardium, otherwise known as the epicardium, which is the outer layer of the wall of the heart. It's composed of connective tissue and is covered by epithelium. The epicardium is also known as the visceral pericardium, and it provides an outer protective layer for the heart. Moving on, we're pointing out the apex of the heart, which is the tip right here, and then the base of the heart, which is the longer portion at the top. Moving on, this is the right atrium. The blood in the right atrium is deoxygenated, and over here is the left atrium, and the blood in the left atrium is oxygenated.
Go ahead.
This is the auricle of the left atrium, and this right here, this fold is the auricle of the right atrium. What are they used for? So the right auricle collects deoxygenated blood and pushes it to the right ventricle, and the left auricle collects blood from the lungs and pushes it to the left ventricle. This is the right ventricle here and the left ventricle here. This is the anterior interventricular sulcus. The major blood vessels that are found in the sulcus are the anterior interventricular artery, the right coronary artery, the interventricular artery, the auricle artery, the anterior interventricular artery, and the left and right coronary arteries. Here it's maybe hard to see, but next to the pink straw, this is the pulmonary trunk. The blood travels from the pulmonary trunk to the lungs and is deoxygenated. This opening in the middle that I just took the pink straw out of is the aorta, and the blood from this vessel is going to the body tissues, and it is oxygenated blood. So this structure right here is the ascending aorta. Unfortunately, this specimen is very, very well preserved and very squashed. And I will name the three major. The aortic arch is here. Unfortunately, again, it's been cut off, and the three major vessels are the brachiocephalic artery, the left common carotid, and the left subclavian. Here's the superior vena cava. Below that is the inferior vena cava, and the coronary sinus, which is over here. The blood from these three vessels is going to the right atrium, and they are arteries, and the blood is deoxygenated. So following the directions, I hope I am doing this in the correct cross section. This is the right auricle. Carefully cut down the posterior of the right side of the heart. So I am going to cut this way. Hopefully that is correct, or I'm going to have wasted the specimen. I think so. There we are. Okay, this is the pedicate of the right atrium. The myocardium would be here on the left and right ventricles. The trabecula is the inner surface of the ventricles. So it's that kind of white right there. The myocardium, oh, I've already shown that, sorry about that. And the intraventricular septum, which would have been the inside of this. And it's the line that really separates the right from the left ventricles, right there, if you can see that line. The bicuspid valve, which would be here. The tricuspid or right AV valve. So the left would be on this side and the right would be on this side. The chordae tenendae, hopefully I have not mispronounced that, which would be over here. And the cusps of the valve, which I am not able to locate. The papillary muscle, which is here, I believe. The tricuspid valve, these are this is not a great specimen. Should be here, if you can see the valve in there. And the pulmonary semilunar valve would be the valves down here, and then back up to the aortic semilunar valve, which would be the aortic valve from the top. So it should be this large valve here.